Is there evidence that removing teeth can cause further airway issues?
There was a study by, I believe, Larson in 2015. It's actually a very poor study. They looked at, like, it was like 1,000 patients, and still was, I think it was like a 12% difference in those who all had 4 biexos and whether or not these patients had obstructive sleep apnea later. Now, the first part about that we need to clarify is what's obstructive sleep apnea? So a patient could still be suffering from sleep disordered breathing or have a sleep-related breathing disorder, which is a spectrum of disease from primary snoring to OSA. So you have primary snoring, you have upper airway resistance syndrome, you have obstructive hypoventilation, and then you have the end stage of OSA. And along that spectrum, there's a different level of severity. And that is not, if you read the medical sleep literature, that is far from the truth. Or if you talk to a pediatric ENT or a pediatric sleep physician, they will quickly tell you that's not the case. Christian Gimeno, who created this index in the 70s, I know well people who, and have been on my show, who trained under him and knew him. And he said creating the pediatric AHI scale was one of his biggest regrets, because it created this false sense that if a child doesn't have an AHI score of 1 or greater, then the kid is okay and has no sleep issue. They might still be having all these other issues. They might be having changes that are not registering them as diagnosable with obstructive sleep apnea, but they could have a sleep-related breathing disorder, which we know the comorbidities associated with both behaviorally, neurocognitively, and in their craniofacial growth and development are significant. We're treating the symptom. What I say is, you're not treating they're not treating the problem, the etiology. You're treating the symptom. Does extracting teeth preclude you from addressing the airway problem? So by treating the symptom of the crowding, you are not addressing the underlying etiology, and you are setting that patient up for an airway problem to either continue to develop, become, or exacerbate over time, or develop one over time, because of the fact you're not addressing and normalizing the anatomy. So no, I don't believe that just pulling teeth causes airway issues. But yes, by pulling teeth, you are avoiding and neglecting the airway underlying etiology of that, which can be associated with airway problem. But that doesn't mean that they don't have an underlying airway problem. And that doesn't mean that by not addressing that, that you're not going to potentially be causing that patient harm down the road.